Thank you all for joining us today. My name is Zack Goss. I'm joined by Sheehan and a few representatives who will introduce momentarily from our carriers. This is a town hall series that we've been conducting to discuss the various enhanced subsidies and benefits available through the state of Vermont due to the American Rescue Plan Act. Again, this is our sixth town hall and our final town hall to discuss these options with you. What we are making available to you is a Q&A box where you can type your questions into the chat. So it's not interactive by voice, but it is interactive by chat. And if you type your questions into the chat, we will try and get to all of those questions during the town hall today and answer them live. This session will also be recorded and shared online, so if you're unable to attend now, you can attend at a future date by going on to Vermont Health Connect website. So without further ado, let me introduce Sheehan, who is a senior policy analyst with the Department of Vermont Health Access. And Sean, I don't know if you want to kind of kick us off into the topic today and just kind of share a little bit about what we're going to be discussing.
Yeah, absolutely. Yeah, thanks, Zach. Great to be here. As you mentioned, we're doing this series for a while now, a good bit of the summer, and we're past summer. We're into fall now. But the American Rescue Plan's a really big deal. Really changes the calculus, changes the numbers of what health insurance costs for Vermonters for the better, for people who don't get insurance through their employer. They either get it on their own or if they buy it direct from one of the health insurers, BlueCross or MVP, or if they don't have insurance and need to get it. So that's what we've been talking about. We've been talking about people having this opportunity to October 1st. October 1st seemed way off in the distance, and now it's 2 days away. It's this Friday. So Vermont doesn't have many uninsured people, but we want to reach them. We want to make sure if they think health insurance is too expensive, which we know from surveys, most people who are uninsured say they're uninsured because it's too expensive. We want them to know those numbers have changed. So we want Vermonters to help get the word out to them to take a look and to do so before Friday. And we're also appreciative of Northeast Delta Dental being here, because even though the subsidies can't be used for dental insurance, dental health is certainly a very important part of overall health and impact on people's budgets. And to the extent they can use some of their savings they're having by not paying so much for health insurance to take care of their teeth, that's a great thing too. So we appreciate Delta Dental being here. We appreciate BlueCross, BlueShield being here, and we appreciate MVP being at some of the past events, even though they can't make it today. Our insurance company partners are great partners in helping Vermont get the health insurance and dental insurance they need, and looking forward to talking right this hour.
And thanks, Sean, and that's probably a great segue to just do a quick introduction of our health insurance representatives who are here today. I know, they've been part of this series, like you mentioned, Sean, since the summer into the fall, and things are getting cooler. Temps are dropping. We're starting to see the leaves change. So I'm just wondering, when I introduce you, if you can just share a little bit about what your favorite part of fall is, and I'll go over to Debbie first from Northeast Delta Dental.
Well, good afternoon. Yes, I'm Debbie Bayers. I'm the manager of the eligibility department here at Northeast Delta Dental, and I think the one great thing for me is the heat kind of dissipates away and we have some cooler air. So that's what I like, along with, the trees and so forth, but just that humidity eventually is gone. or it's gone. So, yep, I like it a little bit cooler.
Thanks, Debbie. And like Sean mentioned, Debbie will be here for questions about any questions you have specific to Northeast Delta Dental plans or insurance. So she's going to be on during the town hall, and we can send any questions directly to her and have her come back on if we have questions that come up. Next, I'm going to go over with the same question to Cindy and Jordan. I'm not sure if you're both available to introduce yourself, or if I should just go to start. I'll start with you, Cindy. And if you could just introduce yourself and share what you're looking forward to about fall, that would be wonderful.
Sure. My camera isn't working, so I apologize for that. But my name is Cindy Blanchette, and I am the manager of our sales and service team at BlueCross and BlueShield of Vermont. And I think my favorite part of fall is certainly the colors, but I like it more when the leaves are falling off the tree and it kind of takes you back to your childhood. So you go kicking and running through this pile of leaves. And so even though I'm older now and wouldn't necessarily jump into a pile of leaves, I just love it. I love the smell of the leaves.
Great. Nostalgia.
Thanks, Cindy. Yes, definite nostalgia. And I know that Jordan's here too. Jordan, I don't know if you want to take a moment to introduce yourself as well.
Sure, thanks, Zach. So my name is Jordan Benson. I'm a consultant for BlueCross BlueShield Vermont on the sales and service team. And my favorite thing about fall is I'm a huge football fan. So once fall hits, football season's well underway through the winter.
Thanks, Jordan. I couldn't tell if you cut out, but it sounds like I think you're probably not alone in getting excited to see all those football games coming onto the schedule. So without further ado, I'm going to turn it back over to Sean, who's going to kind of reintroduce.
What about you, Zach? What's your favorite thing about fall?
Fair enough. Yeah, I'm going to go with Debbie. Actually, the kind of cut on the heat is really welcome. Although I was just talking with some colleagues earlier today about how nice it is to have that cut and heat, but how short it is in Vermont. You know, it's only that these shoulder seasons, 2 or 3 weeks just doesn't feel like it's enough, you know. So moving on to the topic for the day, as we've discussed in our prior town halls, the American Rescue Plan Act provided a lot of additional financial help for many folks around the country, and specifically for Vermonters. And we've been talking about how that applies to health insurance today through Vermont Health Connect. So Sean, I'm going to kick it back to you to kind of start off with our opening, our what's becoming kind of our usual opening quiz for people to get acquainted to the savings that are available.
That sounds great. So folks who are at the last town hall might think this question sounds a little similar to the last one, but it's a little bit different. And the context of it is that the federal government, our partners at Health and Human Services and the Centers for Medicare, Medicaid Services, released a special enrollment period enrollment report. As we've been talking about, the special enrollment period here in Vermont runs until this Friday, October 1st, meaning that normally people can only sign up for health plans during open enrollment, which is in the fall, to sign up for the next calendar year. But this year, because the American Rescue Plan Act made healthcare so much more affordable, gave more financial help to more people, they wanted to allow people to sign up. And states that run their own marketplaces, like Vermont, and Vermont's marketplace is Vermont Health Connect, States that had their own marketplaces were allowed discretion of how long they wanted their special enrollment period to run. So even though the federal government and a lot of states that follow the federal government wrapped up on August 15th, we kept it running until October 1st. There's a few states that are going past October 1st or had dates that weren't August 15th, but most were August 15th. So they released the special enrollment period enrollment report showing the impacts of people who signed up during the special enrollment period. Obviously in Vermont, some more people can sign up the next couple days. We hope they will. But together they looked at nationally, found that more than 8 million customers who had already had health insurance before the American Rescue Plan, that they took advantage of the American Rescue Plan subsidies to lower what they pay in their monthly premium. The premium being the bill you pay each month to keep your health insurance. And people could take these new subsidies either to lower their monthly bill, or as many people in Vermont didn't do anything, didn't take their subsidies, they'll be able to get it when they pay their taxes next winter. They'll get a bigger tax refund than they might have otherwise. Other people used the additional financial help to get a health plan that would have lower out-of-pocket costs. Health plans, as you'll see when you go to vermonthealthconnect.gov, have bronze, silver, gold, platinum, and the metal level doesn't dictate what services are covered. It's the same essential health benefits, the same services are covered with all the plans, all the metal levels. Just depends on how much you pay, whether you have a higher premium and lower out-of-pocket costs. When you those out-of-pocket costs being what you pay, things like copay and your deductible when you go to use services or get a prescription. That would be a gold or platinum plan, would have a high monthly premium, a high monthly bill, and lower out-of-pocket costs. A bronze plan would have lower monthly premium and high out-of-pocket costs. So many people used their additional subsidies to buy up a plan. If they were in a bronze plan, many times they could find they could get a silver plan for for no monthly premium or very low monthly premium, and then have lower out-of-pocket costs as well. And so what the feds looked at here was for each state and nationally, not the people who bought up to higher plans and ended up paying more than they were before, but having lower out-of-pocket costs, not looking at people who were waiting to get their subsidy when they file their taxes, just for people who were paying a lower premium than they were before the American Rescue Plan. And they found that on average, the average person saved $67 per month from what they were before. So the question for all of you in this quiz, and I apologize for the long-winded quiz, but only doing one question for that reason, and that is, here in Vermont, if that national average was a $67 savings per person per month, what's that average savings for Vermonters who took advantage of the opportunity to pay less? Is it $61? Is it $80? A little more than the national average, a little less than the national average? Or is it more than double the national average? Is it $155 or nearly triple the American average at $186? If everyone shouts out their guess. I was going to put our partners all here on the screen on the spot, but I won't do that. That'd be mean. I'll let everybody think of their answer. So how many people thought $61? Unfortunately, that wasn't right. Well, fortunate for Vermonters, but unfortunate for people who guessed. Well, the people guessed $80. You'd be right if you were in one of our neighbors to the east or south of us. $80 was the savings in New Hampshire, and in Maine and Massachusetts, it was nearly $80. I think $78 and $72 respectively. So they were also saving more than the national average. In New York, the average New Yorker who took advantage of the savings saved $155 per month, and here in Vermont, the average savings was $186. per person per month who took advantage of it. So it's a really big deal. What that represented is close to 2/3 savings, at least. So of these people who are paying less, who applied their subsidies as a discount to pay less on their bill each month, they had been paying on average about $300 per person per month for their health plan. After the American Rescue Plan applying this, they're paying just over $100 per person, and many people are paying a lot less than that. A lot of people are having zero premium plans, depending on what their income is. And so that's really why we're trying to hammer home that point. Of the 20,000 or so uninsured Vermonters, as I mentioned, most of them said that the cost of health insurance was a big reason they didn't have health insurance. Before the American Rescue Plan, people that were making more than 4 times the federal poverty level, so about $50,000 for an individual or $100,000 for a family of 4, they couldn't get any financial help. They would have to pay full cost. Now people at those levels are getting thousands of dollars per year, and their health insurance is much less. So those are the people we're trying to reach. If they haven't come back and looked at the plan comparison tool, that's one of the things we're asking them to do. We're trying to get the word out to come back to vermonthealthconnect.gov. This is the homepage you'll see right here. There's 3 things to pull out, but encourage people to check out all the other links too. But that plan comparison tool, the shopping cart, if you click on that, it'll ask about the ages and number of people in your household that need health insurance, what your household income is expected to be for this year, for 2021, and it'll tell you what you qualify for in financial help. And then you can look at all the plans from BlueCross and from MVP on the health plan side, and see what they would cost you after those subsidies. As I mentioned before, you can also find information here on vermonthealthconnect.gov about the dental plans. You can reach out to Northeast Delta Dental. And if you have any questions for BlueCross or Delta Dental, as Zach had said before, I encourage you to put them in the question box. There's also that link there to the American Rescue Plan Act. Talks a lot more about what you need to do to sign up under the special enrollment period. As I mentioned, you only have until Friday. Phones will be open till 4:30. They're open 8 to 4:30 today, 8 to 4:30 tomorrow, 8 to 4:30 Friday. Good chance to sign up. And then there's the information on the website there for signing up by phone, online. There's also in-person assisters. Although at this time, reaching out, making an appointment with an in-person assister in your community, they're working in all 14 counties, would be a great opportunity. But I know, Zach, you're probably better positioned to talk about assisters. I'm guessing at this point, being 2 days before the special enrollment period deadline, might be a good time for people to reach out to assisters, but thinking more about an appointment for open enrollment or 2022 insurance, right? If people want to get their 2021 insurance, if they're not signed up yet, they should probably call the toll-free 855 number, right?
That's right, Sean. Yeah, the assister program is a fantastic way for folks to get help with their health insurance enrollment or general questions about how to maintain their health insurance. While it is possible they could help for this deadline, for this October 1st deadline, which is Friday, they do ask that people call them and make an appointment. And at this point, it's very close to the deadline, so it's more likely that they would have time after October 1st. And if someone is trying to make sure they can get their coverage before this deadline of October 1st, I think their best bet is to call the customer service line, which is 855-899-9600. And like you mentioned, Sean, they're open till 4:30 and can help actually walk you through the entire application if you need to, but can also answer questions and point you in the right direction. So Sean, you'd mentioned that the deadline for this special enrollment period being Friday, October 1st, and I just want to clarify for folks, and maybe you can elaborate a little bit on this. That would be for for folks who want to get insured through the special enrollment period for coverage through the duration of this calendar year, but not into 2022 necessarily. Is that right? Because the plans will be different in 2022 than they are for the remainder of this year. Is that right, Sean?
Yeah, that's right, Zach, and it's a great point. But also, I think to call it that people don't have to, you know, they're kind of worried about an application process and want to get insurance now, but don't want to go through it all in a couple of months. You know, fortunately, you won't have to if you sign up today, tomorrow, you know, Friday, you choose your health plan with Blue Cross or with MVP. You get your Delta Northeast Delta dental plan if you want as well, or not, just get the health plan. I mean, it's completely up to you. But if you do that, whatever you sign up for, in just a couple weeks, you'll be starting to get renewal notices from your insurance company and from Vermont Health Connect about the 2022 plans. And so if you sign up for you know, for example, say you sign up for a standard silver plan with Blue Cross and you choose that. If you don't do anything other than pay your monthly bill each month, you will be automatically enrolled into the 2022 version of that plan, the standard silver Blue Cross plan in that case. Similarly, if you were to sign up with MVP for their standard bronze plan, the same thing. You would automatically be enrolled in the MVP standard bronze plan for 2022. You would get letters from both your insurance company and Vermont Health Connect letting you know how your monthly financial help is saving. The great news about the American Rescue Plan, we've talked a lot about the last two town halls, I don't think we have this one yet, is that that extra financial help is good for both 2021 and 2022. So while the cost of the monthly premiums, unsubsidized premiums, have gone up in most cases, the financial help has gone up even more. And so many people are going to find that they're actually going to be paying less for their health plan in 2022 than they were in 2021. So that's another thing I would want to underscore too, that if you're at the point now, you think, okay, there's only 3 months left in the year, it'd be nice to have health insurance, but I don't want to go through an application process now and have to do it all again in a couple months, number one. Number two, I don't want to have these, nice lower costs than we've seen, ever before for 3 months, and then have them jacked up on me next year. That for 2022, those health plans, the subsidies are there for people if their income are staying the same, households are staying about the same. They should find that their health insurance costs will be about the same, and in many cases even less. Number one, and like I said, you don't have to do anything if you don't want to actively renew. You'll automatically be renewed into your same plan. Now, having said that, we do encourage people to use the plan comparison tool each year, and the 2022 version of that plan comparison tool will be out in just a few weeks. It'll be out by mid-October. So we encourage people to go look to see how things have changed, maybe how your health care needs have changed as a household, and look to see what prescriptions, if any, how they're covered by various plans with Blue Cross and with MVP to make sure you're in the plan that's gonna save your household the most money. But again, that's optional. You can be enrolled right into 2022. And one other change we haven't talked about, but we'll be talking about in the next few months, is that's the case for both the dental plans and the health plans, is that starting in 2022, so starting with the bill people get in December, those bills will be coming from their insurance companies. Prior to now, they had, and I guess through early November, they've been coming through Vermont Health Connect. People have paid Vermont Health Connect for the premiums. Vermont Health Connect, has passed those payments on to the insurance companies. Starting in 2022, so starting with that first bill for 2022 insurance that comes in early December, people will be sending their payments right to their insurance company, and that'll make things a little more streamlined, to know where to go to set those up. A lot more information will be coming on it. We don't need to get it here, but to the extent, I think worth bringing up here, to the extent that people know somebody, if you knew somebody that had a bad experience with with bill paying before, certainly in the early years of Vermont Health Connect, that was more of a problem, and whenever there's more hands involved, there's always, I guess, the more potential for things to get caught in the shuffle. So if you hear of that being an issue with anybody, that's another reason. Great to encourage people to come back, tell people they can sign right up with Vermont Health Connect, qualify for those lower insurance costs with the MVP plans or BlueCross plans, and then pay their premiums directly to Northeast Delta Dental, to MVP, to BlueCross.
Thanks, Sean. That's all really helpful information. And I just wanted to put a plug in before I forget, for those who are attending, that if you have questions, please feel free to use the Q&A option on your screen. You can type a question into the chat, and we will see that and get that to our experts, whether it be Sean or one of our carrier insurance company representatives. So this is certainly a welcome opportunity for you to pose those questions now, or you can pose them in the chat as they come to you later in the town hall. I have a couple questions for you, Sean, to follow up to some of what you were just speaking about. The first thing is, I know that last town hall we talked some about the COBRA provision in the American Rescue Plan Act and how that applies to folks at this juncture deadline of October 1st, and just 2 days away, and whether they have other deadlines that they need to think about with the COBRA, and what in fact they would be eligible for on Vermont Health Connect. And the other question, the other thing that maybe you can tackle when you answer that is, I just want to confirm that folks, to receive all these subsidies, these additional benefits, will still have to come through Vermont Health Connect to get those. They can't go directly to the insurance carriers to do that, right?
Yeah, that's exactly right, Zach. To get the financial help, people have to sign up through the health insurance marketplace in their state, and in Vermont. Vermont's health insurance marketplace is Vermont Health Connect. So people sign up. They're the same insurance plans that people can get through BlueCross and through MVP. But to get those lower costs that now most people qualify for, as I mentioned, it used to be those thresholds around $50,000 for an individual, $100,000 for a family of 4. Now it effectively goes by the plan coverage tier people are in. So people who are in single plans for 2022 will be able to earn up to $105,000 per year, and will still get those lower health insurance costs. And people who are in a family plan can have an income of $297,000 and still qualify for lower costs. So, this is Vermont. It's not Beverly Hills. I don't think there's all that many households around earning over $300,000. So any that are in the family plan, having that chance to get those lower costs, is a great deal. I mean, there are the other requirements. People have to be legally present in the state. They can't have an offer of insurance, an affordable offer of insurance through their employer, things like that. But people who are uninsured, don't have another offer of insurance, if they're direct enrolled through their insurance company, or if they need insurance, it's a good chance they'll be able to get financial help. And actually, I think that's probably a good point and segue. I'll address the COBRA piece too. as you said, that kind of two. Well, maybe just to start on the COBRA side. So COBRA, for folks who aren't aware, is a federal law allowing continuing coverage for people who get employer-sponsored insurance. When they leave their employer, they're allowed to keep their employer-sponsored insurance for 18 months, but they're not required. The insurance, their employer isn't required to continue paying for it. So people usually pay 100% of their healthcare costs, or 102%, with the extra 2% being the administrative costs. And so it's very expensive, because on unsubsidized health insurance, if you don't have the financial help through Vermont Health Connect, or if you don't have the employer picking up part of the tab, is very expensive. But for people who are in that position, it often can be a good path for people to go in. Maybe particularly if it's in the middle of the year, and maybe you've paid a lot toward, you've met your deductible, so the costs are going to be fairly low, for the rest of that point. And that's something that normally, once you took it, you'd have to either wait until an open enrollment period to switch over to the marketplace, or the end of your 18 months. But with the special enrollment period, people are able to come in through October 1st, and it's significant because as part of the American Rescue Plan, in addition to all these subsidies we're talking about, the federal government also said they would pay people's COBRA insurance, pick up 100% of the tab of that through the end of September. And we're at the end of September, right? It's tomorrow. So those people who are on COBRA are faced now, they were paying zero premium for the last 6 months, potentially going to be paying a lot starting Friday. So if they want to drop their COBRA insurance and sign up for marketplace insurance through Vermont Health Connect, they can do so today, tomorrow, Friday, and have their health insurance start on Friday. So have the marketplace insurance starting Friday, have that seamless, no gap in coverage, and not have to pay those COBRA costs on their own. So that's a great opportunity for people. For people that have a lot of health care needs, have met their deductible. The deductible will be resetting when you move from employer-sponsored insurance into marketplace coverage. So that would be, I think, the one consideration for somebody that has a lot of expensive prescriptions and might have met their deductible. Yes, it'll be expensive to pay your COBRA for the next 3 months potentially, but maybe it would be worthwhile for you to do that. But because then your COBRA insurance is going to reset in January anyway, certainly be sure to come over in November, when you can sign up for marketplace insurance and switch, for the start of the year. But if you're not in that boat and you haven't met your deductible and you don't want to pay those high COBRA costs, come over the next couple days and see. The two additional points I was going to flag was about the deadline. So we talk about the deadline for people that don't have insurance to come in by October 1st. For people who have COBRA, you actually now will have 2 more months if for some reason you miss Friday, and that's because there's a new rule that was just adopted. I was going to say it's just gone into effect. It actually will only go into effect on Friday, but a new rule saying that going forward, any subsidies, whether they be from the federal government or employers, because sometimes an employer will say they'll pay for your COBRA for the first 3 months, which is nice, but then you got to pay for it on your own after that, and you're kind of in the same bind that people find themselves in now. So the new rule says that within 60 days of losing your subsidies from an employer or from the government for your COBRA plan, you can come over and have a special enrollment period to sign up for marketplace coverage. So if you know of anybody that's on COBRA, say you're talking to them at a party this weekend, you said you saw this town hall, we're wondering if they took advantage of moving over to the marketplace. They said, oh no, I missed it by a day, Murphy's Law, I'm too late, I missed the boat. Actually, they'll be too late for October insurance, but they'll have those 60 days so they can call, on Monday and have marketplace insurance starting November 1st and only have to pay for their October coverage. So that's one piece to get out. The other piece is for people who are direct enrolled. We've talked a lot about, and you and I have talked a lot, Zach. If Cindy or Jordan have comments on this, or if William or Debbie have insights on how COBRA works on the dental side, which I'll be honest, I don't know a lot about. Happy to open it up to them, hear their thoughts. But the one piece on the direct enrollment side is that people who are currently direct enrolled with Blue Cross or with MVP, and they want to change their plan over so they could take advantage of these lower costs, they're not tied to doing that by October 1st. Would encourage them to do it today or tomorrow, because as long as they do it by the end of the month, they can have their marketplace insurance start, the first of the next month, meaning they're getting those hundreds of dollars back as a tax refund or lower costs. So the earlier they act, the earlier they get it. But if they don't act till next month or the month after, you can always transfer your plan from Blue Cross or MVP over to the marketplace, or vice versa. And that's something that certainly we encourage people to do. And in that case, we talked some about those deductibles not transferring when people come from a COBRA plan into the individual market. Because the marketplace and direct enroll are all individual market, as long as people stay with their same insurance company, those deductibles will follow you. So there's really no reason not to transfer your plan over to the marketplace, as long as your income is at those eligible thresholds we talked about.
Sean, there's a lot, the whole health insurance landscape is really kind of changing as we speak, and there's all these opportunities, but also all this new information. And one of the things that I wanted to bring up is just how robust the Vermont Health Connect website is, actually, that houses a lot of this information. Folks can actually go online to Vermont Health Connect's website and see a lot of what Sean is talking about in writing. And for some people, it's nice to both hear it being said, but also be able to read it for themselves. And there's connections to resources and other information, other materials, whether it's for your own use or whether you want to share that with people. We have some kind of external facing stakeholder toolkits, we call them, to share with different audiences if you feel like this message that Sean is speaking about needs to be echoed throughout your communities, but also more detailed information on our various web pages that really goes in depth and explains what Sean is speaking about, and even have FAQs, and question and answers with common questions that people may wonder. But beyond that, I also just wanted to put another plug in for our call center is available to answer questions about this. We realize that this can feel overwhelming and very complicated, and has a lot of financial implications and health implications. So we want you to feel empowered to call our call center, reach out to our assisters, in addition to accessing this information on the website. We want this to be as easy as possible for you, and a lot of these benefits you can enroll, online just on your own without having to necessarily reach out to our support center or our sisters. But please know that there are those resources available. So, Sean, or I know that Sean, you mentioned something about, COBRA and how that works with the carriers. I don't know if Debbie or Cindy or Jordan or William, any of you wanted to add to that. If not, I can send it back to you, Sean. But I'll just feel free to speak up, our carrier guests, if you would like to add anything.
Hi, this is Cindy. The only thing that I'd really like to add is that in addition to all the wonderful support that Vermont Health Connect can provide to you in their websites, we're also here to help you. We can help answer those questions about COBRA. We can help answer some high-level questions about the what this might mean to you. In addition to that, we can also help you understand some of the complexities of the plans that you might choose. And that, might work best for you or for your family. So we're also here to help you in any avenue that we can.
Thanks, Cindy. Yeah, I really appreciate you sharing that. And we always say, for specifics about the plan, questions about plans or coverage choices, the carriers are the best people to speak to about those specific questions.
Yeah. Thanks, Cindy, and thanks, Zach. Certainly agree with what Zach said. And as we talked about the plan comparison tool, people being able to see those plans from the issuers, that's really, you can spend a few minutes and get a quick sense of how much financial help you'll get, what those monthly premiums are going to be with any given plan, and the out-of-pocket costs. But still, having that many plans to choose from can be overwhelming for a lot of folks, and I think it's a good plan comparison tool, offers a great place to start. But then it links over to the insurance companies for things like their provider networks, so you can see if your doctors or specialists you go to are in their networks, as I mentioned, to see their prescription formularies, if there's certain prescriptions you have. And then, as Cindy said, just really even understanding those plans at greater detail. I think kind of the three forks in the road we identify a lot are at the different metal level we talked a little bit about, from bronze up to platinum. Obviously the insurance companies, with MVP or BlueCross, and the differences there people can understand in talking to the insurance companies, and with Northeast Delta Dental, questions that people have about dental. And then also, as far as the plan designs go and the differences there, I think as people try to understand the deductible plan versus a high deductible health plan, also known as the consumer directed health plan. And so to the extent, with those latter high deductible health plans being able to be paired with health savings accounts, those are questions that I know our insurance company partners can answer, right? As far as how people would go about setting up an health savings account if they don't already have one through their employer, or what those kind of pros and cons would be, because oftentimes when you're on the plan comparison tool, you'll see that a high deductible health plan might have the lowest expected total costs, but that term high deductible health plan, or the deductibles might seem scary to folks. And so I think thinking through those those strategies of how people might prepare for the unforeseen circumstances is something that I assume would be a good thing to call the insurance companies about. Is that right, Debbie? Or
that makes perfect sense. Yes.
And yeah, anything else you have on any of the topics on the COBRA side, or building off what Cindy was just saying, and anyone else?
No, I support what Cindy says 100%. We're the same. We are here to help our customers and our consumers, and we encourage and invite people to give us a call so that we can help them to make some of the decisions and guide them along through the process. We find that sometimes people just don't know where to go or what to do, or they'll say to me, "What's next? What do I do after that?" And it's like, "You're all set. We'll watch for your ID card," or something like that. And it makes it a heck of a lot easier for the consumer. And believe it or not, it's even easier for us because we do understand it, and we're able to maybe break it down in terms that are more understandable. So, yeah.
Great, thank you. And Jordan, yours lit up too. I didn't know were you. You're adding.
Yeah, I was just going to comment, as you mentioned, with the high deductible health plans, CDHP, what we refer to at Blue Cross, or the HDHP. We can certainly, go over the process of setting up a health savings account, as you mentioned, if they want to pair that with those type of high deductible plans. So we can certainly assist with that.
Great, thank you.
And Sean, I just wanted to share also with folks that if you, and I imagine that our carriers, as well as there are other places where you can find this information, but on our website, at the Vermont Health Connect website, a lot of what we're talking about may sound like a foreign language. So there is a list of terms in our under our Learn More section, where you can read probably most of the terms that you may be unfamiliar with, to learn a little bit more about what that actually means. And if you're the kind of person who kind of likes to do your own research and put two and two together to figure out how to make your decision and really understand it, the kind of details and nitty gritty, you can dive pretty deep there into that information. So I just want to put a plug in for that as well. I know that with these kind of complex decisions, sometimes people really want to get an in-depth understanding, and that information should be available to you. You can also always email us a general question to our general email at Vermont Health Connect, and we can answer your general questions. Please don't submit any personal information there, but we can certainly answer general questions if you ever wonder about dates or processes, etc.
Great. Yeah, thanks, Zach. Yeah, and I think the other thing to reach out about, probably you propose we wind down on the special enrollment period, and we hear those numbers. Great to hear that Vermonters are saving more on average than people on any other state, and numbers are great, and they're one thing. But talking, I know, to some of our sister partners who you work closely with, Zach, and we hear their stories of, there's not just numbers. There's obviously real people's lives behind there, and people who either hadn't been able to have insurance for a long time and now can afford it, what that means to them, or people who hadn't been able to afford a plan with low out-of-pocket costs and now can. And had been putting off, a surgery or a procedure they needed for years, and lined that up, and just how much that means to them and their family. It's pretty moving, I think, particularly for those of us that deal with the number side and not as much directly with people as the sisters do. I mean, those stories are really powerful, and I don't know if you have any others to share, Zach, or if the other partners on the phone, just kind of hearing those things about how meaningful this is. I know from those conversations we had with a couple of the sisters, it was pretty powerful to hear those stories.
Absolutely, Sean. I'm glad you mentioned that, because I know, and you may know the exact number a little bit better than I do, but whatever the percentage of our total income is taken out for healthcare costs, when that percentage drastically goes down or goes away completely, the amount of income that we can put towards other things that are also priorities in our life, like basic needs, can really make a huge difference in the quality of people's lives. And I know you're absolutely right. We've heard that from the sisters, and I can't remember. I don't want to misquote the actual percentage of household income spent on the average amount spent on insurance or healthcare, but it's very significant.
Yeah, I think as far as the economy goes, it's about 20% of it. It's obviously different at the household level, and varies depending on what's kind of hidden and paid by employers, and in lieu of salary people could be making, and other things as well. And certainly we see people who come through the marketplace for many years who were unsubsidized. It wasn't uncommon to see people who would be paying well over 10-15% of their income for just the health insurance policy, and then out-of-pocket costs on that. So yeah, you're absolutely right, Zach. When people have the opportunity to have very low premium and low out-of-pocket costs, and suddenly have thousands of more dollars in their monthly budget to be able to take care of things they couldn't before, or pay off some debts, or have some flexibility to put it toward education, help all sorts of things. It's a huge impact, and we want everybody who can be taking advantage of it to do so.
Yeah, and it makes me think, as we wind down, I'm looking at the clock, and we don't have too much more time here today, but it makes me think a little bit about spending just a little bit of time on maximum out-of-pocket costs, and that these plans, as it relates to what we were just talking about, many of these plans really cap the amount of money that an individual or family would have to pay on their healthcare costs for the year period, right? So that could so by having health insurance, not only are many of these services covered and lowers, are there opportunities to lower their cost of their health insurance, but they could really know what the total amount in the worst case scenario they would have to pay for health care would be all year. Is that right, Sean?
Yeah, that's exactly right, Zach. And that's one of the biggest things, I think, before the Affordable Care Act, where it came into play. Fortunately, in Vermont, wasn't as bad. I think had more protections than a lot of states, but still there were plans out there that could have no cap on the maximum out of pocket. Meaning, if you got diagnosed with cancer, where treatments could easily be over $100,000 per year, or if you had another accident or surgery, got hit by a bus, who knows what, hospital stays are so expensive, could easily run up a tab of more than somebody's annual income. And with the Affordable Care Act, it caps what people can pay. Now, the bronze plans, we warn, still have a pretty significant out-of-pocket cap. I think for 2022, I believe it's going to be $8,700, which isn't cheap. But compared to not having that, and not having insurance, and the cost of treatments, running into the six figures in some cases, being in the four figures is a whole lot better. But it's still a lot, and still something to plan around. And that's really why we encourage people to look at the plan comparison tool, see what those out-of-pocket costs will be. And I think really it breaks down to what people's income level is and what they qualify for. For people who, when you use that plan comparison tool, if you see that you qualify for, it'll say Silver 94 or Silver 87, right on the plan, which roughly equates to an individual making about $25,000 or a family of four making about $50,000. If you can get that, it means you'll be able to get a silver plan for either zero premium or $10 a month, depending on what the exact income is, very low. But more importantly, your out-of-pocket costs will be very low too, depending on which plan. Your out-of-pocket costs could just be maximum, could be in the hundreds, or could be $1,000, $2,000 max. So a huge difference, from that $8,700 with the bronze plan, and still having a very low premium. For people whose income is higher than that, it may not make sense to be in the silver plan because they won't have that additional financial help. It may make sense to go up to a gold plan, or I think, as Jordan referenced, looking at those consumer-directed health plans and pairing it with a health savings account. I mean, I'd love to hear, Jordan and Cindy, kind of to what extent you advise people. I know we don't tell people what plan or what type of plan to get in exactly. But I think, those plans often work well for people who are younger and good health. If you're somebody in your 20s or 30s, you only go to the doctor once every 2 years for your annual checkup that you should be doing once a year, but go every 3 or 4 years. That's the kind of thing where a bronze plan might make a lot of sense, or a high deductible health plan bronze, that you pair it with that health savings account. You can kind of contribute that money to it, and then in that one bad year you have out of 10, you have the health savings account to pay for it. So you've been saving on your premium. And is that kind of the general sense you get, Jordan, or Cindy too? I saw Jordan's lighting up.
Yeah. I mean, everyone's situation's different. So based on, we have different metal levels and within those metal levels, there's variations of different plans. Like our standard plans, you have co-pays for office visits prior to any deductible. Our preferred Vermont preferred plans allow you a certain number of visits, with no deductible for primary care or mental health counselor. But yeah, I mean, the high deductible plans, you can pair with an HSA. You can put money aside throughout the year up to the IRS limits. If you don't use it, that money continues from year to year. But typically with a high deductible plan, you pay the deductible first, and then you may be covered at 100% if something catastrophic happened, as all these plans provide you a maximum out of pocket limit. So it is variation. We're, as Cindy mentioned, we are here. If you have any specific questions about your situation, what plan is best for you, we can certainly walk through all the scenarios and answer any questions you may have.
Perfect. Yeah, thanks, Jordan. And I think on that time too, as I sort of referenced before, with this funny time we usually don't have each year, special enrollment period going through, the end of September into October 1st. This is usually about the time of year we're getting ready for open enrollment. Obviously, we're doing that too, and the insurance companies are doing that too. But I think for people who are watching this, and like Zach said, there's a lot of information. Encourage people to go to the vermonthealthconnect.gov, encourage you to go to the insurance company websites to call the insurance companies, call the assisters, but don't feel paralyzed by all the data. As you'll see, one of the nice things about being being the end of September and only 3 months left in the year, if you don't have insurance, you can sign up now, pick a plan, see what it is on the plan comparison tool. Kind of can't go wrong with the with the lower cost. Certainly can't go wrong in the sense of you're better off having insurance than risking really high costs. And then you buy yourself that time over the next couple months to continue to learn. And when November, after Halloween rolls around, November 1st, it's the open enrollment period. You can continue to have had those conversations with the insurance company, with the sisters, with Vermont Health Connect, and really be even more confident going into 2022 that you're going to be in the right plan for those 12 months.
Really, really good point about not holding back and definitely reaching out and not being intimidated by all the information and acting, because there are significant opportunities here that we definitely want you to take advantage of, and getting engaged sooner is better. I think on that note, we will end our town hall today. I do want to put one last plug out, excuse me, for the plan comparison tool, which has been mentioned a few times in the last 5 or 10 minutes, which can be found on our website. You can also find information and links to information on our social media pages at Facebook and Twitter. VT Health Connect is our Twitter handle, and you can find Vermont Health Connect on Facebook. Thank you, Sean. Thank you, Debbie. Thank you, Cindy, Jordan, and William for being our insurance company representatives on the call today, available to answer questions and provide all this helpful information and resources for us and for customers.